global development has a very grand mission to reduce poverty and inequality in the world. We do that in a very specific and focused way, which is to scrutinize, to gather evidence on the costs and benefits of what the rich world is doing, what the major global institutions that are part of globalization are doing and not doing. The center was founded by three people: Ed Scott, who's the chairman of our board, Fred Bergston, director of the Institute for International Economics, and myself. Ed really was the start. He was interested in making a difference for poor people on the ground in developing countries.
After I left being active in business and high technology, I was engaged in a couple of child development initiatives in Central America, and then subsequent to that, I stumbled upon a video in the late of night which talked about the burden that the debt imposed by the IMF and the World Bank and by large donors was having on the poor countries.
He did his homework. He talked to people in the U.S., in the U.K. He found his way to Washington. We talked, and we were off to a great start.
But I was counseled by a number of people in Washington who said to me that what was really required was a capacity to provide policy choices. But in the area of development, there was a big hole. There was nowhere for them to turn. So we set out to fill that hole, and I'm very pleased we did so.
A very generous gift from Ed Scott made it possible for me from the beginning to attract the best people, world-class scholars who had substantial research experience and also interest in changing the world and experience in policy circles. And because we started and actually physically spent the first 6 months at the Institute for International Economics, we benefited from the tremendous credibility of the 25-year-old IIE. We began working with partners, other organizations that complement what we do in different ways. We think of ourselves as a think tank plus. The think tank part is producing more than a dozen books and working papers. That's the intellectual foundation of our work. But we also concentrate in the plus mode on a range of approaches to reach out. Those include major public events. We also have small private briefings, the website where we're reaching thousands and thousands of people, an email newsletter. We've had Nobel Prize winners, heads of state, many senior officials. We've had some of the best scholars talking about particular issues. So we made a clear decision, actually, to invest heavily in communications and outreach. That's the ideas to action part of our work. We always look for the question that the evidence around which might yield a win-win solution in terms of better policy. Those things that are done in the rich world can transform the lives of people in the poor world.
The vaccine project that we did, Making Markets for Vaccines, where we developed a proposal for an advanced market commitment for new vaccines for the developing world, was part of our broader program in the Global Health Policy Research Network. And what we're trying to do at CGD is take some of the best thinking in the academic sphere, the most rigorous analysis, and apply it to the really challenging real-world problems in global health.
The project, Making Markets for Vaccines, was really designed to address a problem that's existed for a long time, which is insufficient research and development budgets as well as investment capacity in vaccine development and production for the third world. How do you create better incentives to get the pharma community, the vaccine community, to produce products that are specifically dedicated for the developing world.
Michael Kremer, a professor at Harvard, had been thinking about this problem for many years.
He realized that if the rich countries of the world were to make a promise that they would buy a malaria vaccine if somebody produced it, that would give an incentive to the pharmaceutical industry to go and do the research and development needed to make one. But this idea was unfamiliar. No government had made a commitment to buy a product that didn't already exist, and there were lots of issues to solve. And we brought together lawyers, economists, public health specialists, academics, people from development agencies, to think through how you'd make this work in practice.
The study recommended it wasn't just a set of policy solutions, it was actually a type of contract that could be entered into with the pharma companies that would incent them to dedicate more of their R&D budgets towards vaccine development for the developing world.
GSK has a strategy to develop vaccine for the world, and this advanced market commitment will help us to build capacity and to bring the vaccine to the poorest country in the world.
Immunization is one of the most cost-effective interventions in health anywhere, and certainly in developing countries. And it's really progress toward newer, better vaccines that we need to address the problems of malaria, of HIV/AIDS, and of many of the greatest causes of death and disability in developing countries.
If the G8 or members of the G8 adopt the program, children that otherwise would have died or otherwise would have been ill will become productive members of their economy.
The Commitment to Development Index came out of a lunch I had with Nancy Birdsall. Just early on when she was beginning the Center for Global Development, and we were looking for ways of working together. And I suggested that one way would be to develop some sort of an index. And she said, aha, I have it. We should do an index ranking the countries, the rich countries in the world, in terms of how good global citizens they are and how much do they contribute to development.
What we decided to do was to rate each rich country in each of 7 policy areas, to rank them, and then to communicate the results. And we did this in a way that controlled for size, so that a small country like the Netherlands could beat out a big one like the United States and Japan if it appeared to be doing a better job of living up to its own potential to help. The index is above all a communication strategy because we want to use the device of ranking to get people's attention. And with the website, you can make it very easy for users to jump between different views of the data. They can look at change over time, they can compare countries to each other, they can see which policy area a country is strong in.
The initiative of the Center for Global Development to come with this Commitment to Development Index has been a tremendous help to us at the United Nations to build awareness of what rich countries should be doing.
The index epitomizes the kind of powerful research that the Center for Global Development does and does so well. At the end of the day, it's just a bunch of numbers, but they end up being very powerful numbers because they are change agents.
This index has been used in many parliaments across Europe to actually question their government's policies in order to create the enabling environment for poor countries to achieve the Millennium Development Goals.
Policies are changing and debates are occurring and a conversation is taking place that would not have taken place without this index.
Well, the Center for Global Development really played a key role in Nigeria's march towards debt relief. And the interesting thing is that it all started with a conversation with Nancy Birdsall at Davos, where she asked me questions about Nigeria's IDA position.
In Nigeria, in 1999, President Obasanjo came to power after 15 years of military rule and inherited over $30 billion in debt and made getting relief of that debt one of his top priorities. But he was unable to get anywhere, even to begin negotiations with the creditors because of his country's classification within the World Bank.
Why isn't it being treated like some of the other lower-income developing countries as far as its debt is concerned? And from this set of questions which we bandied around, I said, well, if the center, can help throw some light on these questions as we're trying to get debt relief, this would be very useful.
We ran the numbers, and it turned out that Nigeria had a very strong case for being reclassified. So we produced a paper, we shared it with the key decision makers inside the World Bank, and in June of '05, they were in fact reclassified. The second problem was a political problem. The debt relief is supposed to be for poor countries without cash. Well, Nigeria is an oil-rich country, and oil prices were at an all-time high. So we thought, well, how can we turn this liability into something positive?
They said, well, why don't you think of some innovative ideas? Why not try a buyback?
So we proposed that Nigeria offer to put some of its oil money on the table and to buy back the remainder of its debt.
No developing country had ever managed to persuade the Paris Club to a buyback of even part of its debt. So this was like a monumental task, but the idea appealed that this might be a way for Nigeria to go forward.
This is important for Nigeria, important for Nigeria's neighbors. Nigeria exercises important economic neighborhood effects. It is good for Nigeria, it's good for the region.
There's been lots of concern that the amount of aid that we provide and the way that we provide it is much less than adequate. And in response to this, the Bush administration proposed a new way to provide foreign assistance in March of 2002. The new program is called the Millennium Challenge Account. The MCC is trying to work on improving aid effectiveness, and what that means is that taking our dollars that we provide as foreign aid and making them much more effective in terms of supporting economic growth and fighting poverty in its many dimensions.
From the very outset, Center for Global Development has been a very vital contributor as the MCC started up. We had to find the proper indicators. There were a lot of debates about basically how to do development in a different way, a much more rational way.
We've been involved since the beginning, and we've worked with people at the MCA, we've worked with people up on Capitol Hill. We wrote a book on the MCA that came out long before the program actually came into effect, and many of the things that we suggested and recommended came into force. We now work on what we call the MCA Monitor, and we provide ongoing analyses of the countries that are selected, the programs that are designed, the details of the proposals and the compacts as they go forward. We're in touch with people at the MCA on almost a daily basis. We have public events where we have debates and discussions and analysis of what's going on, what's going well, what's not going well, to try to make these programs work better and ensure that U.S. taxpayer money is actually much more effective.
We need to make sure that money is being spent in the wisest way, both for the donees, the people that are receiving it, but also for the donors, that there will be sustained support for it. And I think what the Center for Global Development does is help to maintain that long-term support for global assistance, for development assistance, by keeping us on an honest and open track.
Those are a few examples of how we have tried to go from good research to real change. And I could not have predicted the kinds of success we've already had, including a really good combination of addressing the right questions and being opportunistic when issues have arisen, because we had developed the stock of expertise that allowed us at the right moment to attack an issue in a way that could make a difference.
The next 5 years will find us in a position to be much more effective and even more influential than we were in the first 5 years. And I think that that's very important because of the people whose lives depend on it and whose welfare depends on it.
Lek ma gesu, chili ma wesu, lek ma reju, wala sakti baku, fugune yi feke, dama len di tete, wax ni mu ma neexi, ma bëgg leen no, damay, telu gune, melni, duma maaka, damay, telu gune, melni, duma maaka, lu ma gën di yàgg, xel mi gën di màgg dellu tuuti tànk mani seetal léeg-léeg ma gëstu ci li ma weesu léeg-léeg ma réccu wala sax di bàkku fugu ne yi fecce dama leen di teete wax nu ma neexe ma bëgg